Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Feeling anxious about your first period is entirely normal. It marks the beginning of a natural monthly cycle that will influence both your body and emotions as you continue to mature. Although this phase is an important milestone in every young girl's life, it also comes with changes that can be unfamiliar. That's why having reliable information and appropriate medical guidance is essential. So, by joining us in this discussion, young girls can gain the knowledge they need to make informed and confident choices. With the right support, this transition becomes far easier to understand and embrace. Welcome, everyone. I'm Dr. Soumya Saluja from THIP Media, and today we are opening the doors to an essential conversation that marks a major milestone in every young girl's journey, the first menstrual period. And to help us understand what's normal and what's not when it comes to your first period, we have with us the esteemed medical expert, Dr. Meghana Phadke Sultania. Dr. Meghana is a distinguished adolescent medicine specialist and senior consultant in pediatrics, currently leading Unit 3 at Asian Hospital and Capsule Clinic, Faridabad. With a strong commitment to child and adolescent health, she has established herself as a trusted clinician for her holistic, compassionate, and evidence based approach to care. Dr. Meghna's extensive clinical expertise spans preventive health, chronic disease management, growth and developmental challenges, and adolescent specific concerns, allowing her to support young individuals through some of the most formative phases of their lives. Her leadership roles reflect her dedication to advancing pediatric and adolescent medicine at both institutional and community levels. She has previously served as secretary of the Adolescent Health Academy, AHA Haryana, and as vice president of the Indian Academy of Pediatrics, IAP, Faridabad, contributing significantly to professional developmental initiatives, public health awareness, and multidisciplinary collaborations. Known for her clarity of vision and her ability to connect with young patients and their families, Dr. Meghana continues to inspire trust and confidence within the medical community. Her unwavering focus on advocacy, education, and high quality clinical practice makes her a respected voice and a driving force in adolescent healthcare. Dr. Meghana Phadke Sultania, THIP Media welcomes you, ma'am.
Thank you. Namaskar to everyone.
Namaskar, ma'am, and thank you so much for joining us today. Ma'am, as young girls, they approach their first period, clear guidance, it becomes very essential. And understanding what's normal and what's not, it helps build their confidence and comfort. So, with that in mind, let's begin this very important discussion with a very basic question that why is it important for teenage girls to know about menstruation and understand the changes that would occur during puberty?
Yes, it's important because when you know the logic and the science behind it, at least in a simple words, then it's very easy for the adolescent girl to go through it. Once you're mentally prepared and you know why it is happening, why it is that way, a little kind of acceptance comes in. It also creates a little curiosity rather than having fear or hatred. All right. Acceptance is the key. And that's why I think we should introduce it.
Yes, ma'am. very rightly said that acceptance is very important before, even understanding what physiological or emotional transformation, a young girl's body would go through. So keeping that in mind, what should teenage girls know about how the menstrual cycle works, especially, in the early months after it begins?
Yes. First of all, they have to understand that it's a normal body cycle when slowly they are going to become from a girl to a big girl and then to a young lady, right? The
Right.
menstruation is essential because at one point of time, all of us think about family and having producing new generation. So it's there with each and every animal. Humans are also a form of animal. So this is a natural course of action. Okay. This is the time where the growth and development is happening, and they have to be on that self care, self protective mode so that they grow and develop beautifully, gracefully, right? All they need to know is that a simple hygiene of private parts, right? Finding a chest rise is normal, but supporting
Okay.
the breast using a simple supportive care, right? These things are very important. Hygiene is very important in terms of preventing infections. At the same time, they have to be little bit aware that menstruation involves presence of blood, but that is not to be feared about. That is
Right.
not to be tabooed because it's a painless one. All right. And if we do appropriate measures to support that menstrual blood, you can carry out your normal activities just like that.
Right, ma'am. Right. And like you just mentioned that, this will be a phase when the girls, they have to accept and be ready for certain changes. So just building on that, uh, I'm going to ask that what physical and emotional symptoms should adolescent girls expect, as normal during their first few periods?
Yes, during first few periods, at times periods are not coming monthly. Sometimes it happens in first 1 year.
Okay.
Uh, After that first period of say 5 days or maybe at times 7 days, suddenly 2 months there's nothing. It's fine. But if
Right.
it is going like 4 months or 5 months, nothing, it is something which is to be discussed with your adolescent health expert. At the same time, the period blood is generally pinkish red. That's what we say, not very brown or something. If
Okay.
continuously it is happening in that way, again, the point has to be discussed.
Okay.
Else, having periods for around about, say, 4 to 5 days, having roughly around 2 to 3 pads a day, and pinkish blood which is coming without any pain, it's normal.
Okay.
Sometimes you feel heavy in your chest just before the periods. You feel heavy at times at thighs, and there's little back pain which involves, which is normal. It is
Okay.
a pain which is tolerable. It's not something excruciating.
Right.
So that is absolutely normal, which you don't have to worry about.
Okay.
Some children often they have searched on Google or heard that something happens to you, which is called as a premenstrual syndrome, and there's a lot of headache, and they worry. They feel how they will go for their sports or their exams. There's nothing to worry. It is not a disease. There is no treatment required immediately for every small symptom.
Mhm.
Yes, sometimes the hormones they go, certain hormones go up and certain go down after which your period starts. So definitely you get little headache sometimes. You feel again chest heaviness and little irritable maybe. But see, there are coping strategies. For example, if you are into yoga, Surya Namaskar, Malasan, these symptoms they do not appear. If you're not taking too much of caffeine, if you're sleeping just right time, these symptoms do not appear. So again, as I said, self-care and self-protection is very important.
Right, right. And we've just discussed the normal spectrum of changes, an adolescent girl would actually go through, ma'am. So just building on that further, how can, young girls recognize the difference between typical period discomfort and symptoms, that may require medical attention, and, they would seek your guidance in that perspective.
I would say the red flags are anytime when the gap in the periods is like more than 90 days between the two periods. One has to consult. There are clots instead of fresh blood drops. There are clots which are dark brown in color. Yes,
Mhm.
definitely. If it is proper red color, as if a cut is there on your hand, it looks purely red. That kind of blood oozing quite a lot, and it mandates suppose more than four pads in a day
Okay.
every time, or period is going for more than 7 days. These are the
Right.
red flags where you need to come.
Okay.
If there is excruciating pain either at back or your lower part of the tummy, that is
Right.
below your belly button and
Right.
or on the right side, then again it is something. If the pain is excruciating, you have to visit doctor.
Right.
If you feel that you're gaining too much of weight, you're slowed down, you're sleepy all the time, and periods are irregular, again, it's better if you consult an adolescent health expert.
Right, right, ma'am, right. And you've mentioned earlier that self-care and personal hygiene is the key, to continue with our regular daily activities. What should teenage girls consider? When choosing menstrual products, we have a good range these days. We have sanitary pads, we have tampons, we also have this period underwear. So, what should be their pick for the first time?
See, generally, those who get periods somewhere around 10 years and above, between 10 to 12, which is
Ji,
nowadays a new norm. So
ji,
then in that case, diaper type means the period panties. They are very helpful.
okay,
Initially, they don't understand. Sometimes it leaks. So they're not very accustomed to it. So I think the mothers can be, helpful by giving them these period panties. At the
ji,
same time, after first 6 months or 8 months are over, slowly they should be taught properly how to put the pad and apply it to the pad to your panty. They can
mhm,
wear the double panties also, as I say, a normal cotton panty, जिसके ऊपर अपनी pad you've put it. On
yeah, yeah,
top of it, another cotton panty can be one that
mhm,
helps in the class, or at times even boxers for that matter. And the cotton based period pads are far better because
ji,
the absorbent material does not cause skin irritation. Okay,
हाँ जी,
otherwise, often the child complains that my skin was soft. Now, because of hormones, it's looking brown, slightly
mhm,
pigmented, and on top of
correct,
it, this irritation is there. So, a
yeah,
little bit of oiling can be done, like almond oil in winters and coconut oil in rest of the days, and
mhm,
that also improves the skin texture, avoids the
mhm,
irritability.
mhm,
Sometimes there are cuts in the groin because of these. There also they can use oiling method, and that helps. Menstrual cups generally we don't advise immediately in this age group. It's little
okay,
difficult to use. It's better reserved for women, I would say.
okay, right, right. And now, coming on to the part that you just said that girls need to be prepared well, and they need some help, especially when they are going to school here. So, what practical steps should young girls, take to feel prepared for their first period, especially, if it happens unexpectedly, away
Yes.
from home, particularly in school?
See, generally, when the chest rise starts initially,
Yeah.
and it takes around 2.5 years roughly to get your periods. For
Okay.
example, if somebody has seen at 10 years of age with a small breast bud, and by
Mhm.
11th birthday, the chest has started growing up properly, and by
Okay.
12 years, there's proper breast formation is there. Then
Okay.
at 12 and a half to 13th birthday, periods are expected. At the
Okay.
same time, when the breast formation is nicely completed, then roughly, as I said, 2.5 years, slightly they feel little secretions also from the private parts. okay, which they also feel that they themselves smell little different at underarms. These are the simple signs when you know that yes, your periods might come. At the same time, you've gained a lot of height. So once that 2.5 year period has happened, it's a good idea to keep a period panty
Mhm.
in your what do you say, the school bag or something.
Right.
Government of India's side, through the mission Kishore Uday MKU, they have started putting and keeping sanitary pads at school also, where the children can go. And
Mhm.
similar practices can be done in private schools. I think some of them are already doing, which really helps the school girls a lot. And of course, you can keep one for your friend always. And if
Yes.
something like this happens, then it's of course you need to use the panty, etc. When you see the periods have started, it doesn't generally start like a tap water. So you
Right.
feel some 2 or 3 drops, some kind of wetness. So you go and check, right? And if
Right.
the drops are there, you use it. So generally, this does not stain your skirt or your pinafore in school.
Hmm.
But
Okay.
suppose girls are didn't realize, which is just very normal, and some stain has occurred. Big
Hmm.
deal.
I agree. Yes.
It's
It's
okay.
normal.
Big deal. Okay.
Yes.
And as I said, apart from your period panty, maybe it's always a good idea to carry simple cycling shorts, which can be worn on inside your pinafore top, right?
Okay.
So you can just remove the skirt and put on those shorts. That's plan
Okay.
A. Plan B, inform your teacher. Nowadays, every school has this phone call thing. Call your
Hmm.
parents, sit in the room, that's fine, and just go home for that day. But
Right.
always remember, if this has happened with anybody, you try to help others so that you have a peer circle who's so supportive. And it's not a taboo. It's okay. It happens.
It happens.
Okay?
Right. Right.
Yes.
Right.
So plan A, plan B, and plan C is do not be ashamed ever.
I
Okay.
think I am going to repeat that too. To not be ashamed of something which is very, very normal. Right.
Yes, yes.
Yes.
It happens all the time. I mean, uh, it's up to you, but I can share my experience. Sometimes it happens with doctors who are ladies, right? And we are on to some or the other work, there are emergencies going on, and you've forgotten,
Yes.
okay? And then what happens? You have to carry on. Sometimes you don't get time even, to use a pad. And sometimes it has happened that we have literally picked up from the hospital also. These are practical problems and they are going to happen not just in school when you grow up. That time also it's going to happen. So why helping hands, Raknika? Okay.
Bil- Bilkul,
Yeah.
Ragnika. And just talking about helping hands, one, I think helping hand would be the health literacy part here, ma'am. Why would you say that menstrual health literacy is important? And how can clear, accurate information help young girls manage menstruation confidently?
It is important because menstruation is not just a process happening to your body. There are two aspects which are involved. One, that you need to take care of your growth and development. Second, you need to take care of hygiene to prevent infection. Third, mental aspect of it, which is it is not restricting or limiting you by any way, and
Right,
feeling ashamed can actually lead to missing of opportunities rather than yeah. So if you are ashamed and you say ki, I have periods, I will not go for that particular competition of your PE class, then you are missing on opportunities. If you're confident, then your mental health will not suffer at all, right?
right,
And the
right,
fourth and very important aspect is that even though the girls are younger, they have to understand that menstruation finally leads to release of that small egg.
yes,
Okay. And that's why the personal safety is very important. Okay. The This aspect is so much so important. That's why understanding that safe and unsafe touch, appropriate and inappropriate touch is very important. From here onwards, fine. You were kiddish, you are still kid, but you're growing up and you will not allow anybody, regardless of gender or relationship, to touch your private parts. We define it as the one which are covered under the swimming suit, be it
Okay.
chest, be it, yes, because that egg will be responsible for baby formation when you grow up at the age of 25 and above, which is the age where you marry. And hence, protecting yourself and taking care of yourself is very important. And this knowledge is apt because nowadays we have a problem of teenage pregnancy, PCOS, and when there's an actual marriage age, you are struggling to have baby.
Yes.
It's a very scenario which is very different, but we can't tell girls not to get educated. We can't tell them not to lead in different sections of society. They have to be, but
Yes.
they have to protect this womanhood of themselves also.
Right. Right. So I'm just going to summarize this wonderful session with one final question: that what healthy self-care habits can support adolescent girls in managing period discomfort and maintaining overall well-being during menstruation?
Okay. First one, I would start with nutrition, that
Yes.
you take good amount of proteins, rich
Ji,
amount of fiber,
right.
and also you have to have good amount of calcium for your bone health and your muscle mass, right?
Ji,
So
ji,
proteins we all know, vegetarian proteins are there, legumes, pulses, egg whites, which is an animal protein, lean chicken is again an animal protein. Try to eat fresh. Second part of nutrition will be your green leafy vegetables, because iron
ji,
and folic acid is very, very essential during this point, right?
ji,
So you have
ji,
to have spinach, you have to have that those dates, jaggery, and
ji,
we always recommend one iron folic acid tablet once a week for adolescent girls, starting from the age of 10 and onwards,
ji,
to recoup that iron source. Okay.
ji,
Second, again, your nails should be cut. There has to be little bit hygienic practice in the sense there is a lot of hair growth, curly hair growth at the private parts. So
right,
initially, rather than using any shaving method, it's good
right,
idea to trim alongside your mother or a trusted lady gender adult, so that you know how to trim it or get it trimmed under supervision. All right.
right,
Changing of panties twice in a day, even when periods are not there. Initially, when you have started with your pubertal spurt, is a good idea because there is a small fluid which comes on too, sometimes urine drops. At the same time, washing of period panties is also very important. This is a little daily chore which I feel girls can start from there for themselves rather than putting it on your mama or anybody. It's a good idea that your stained panty should be washed by you properly and should be properly dried. You can keep a set of dark panties for this period and set of other panties which is for non-periods, right? So that way you can do it. Again, food is there. Then we spoke about this hygiene. And yes, apart from this, your breast support is also very important. Underarm hair are also there. So initially, you can go for the trimming option. As you grow and settle down, you can discuss with your doctor, adolescent health expert, for other methods of hair removal. Okay. Unnecessary removing facial hair and using some flamboyant techniques is not required at this age. These things are finely materialistic beautification, what you do on your face, which can be thought about later when you
okay,
really 18 years and above, or maybe when sweet 16 is happening. But
okay,
again, consent of your mother
mhm,
and your doctor is very important to understand something should not be harming you.
yeah,
Okay, so we spoke about nutrition, we spoke about the body parts handling and their hygiene, and we also spoke about vaccination. Yes, that's very important. So you need to get vaccinated for HPV vaccine. We call cervical cancer vaccine. It has got no relation with your menstruation, but yes, you're powering up your essential reproductive system not to have
Right.
cancer, which is virus based. So we gave 2 doses, 6 months apart, of a 9 valent HPV vaccine. And the
Okay.
last but not to least is exercise. You must not gain weight too much, okay?
Mhm.
Something which is happening as a routine, okay, on the growth charts is fine. So excessive junk food, salt, excessive sugar should not be taken. We do get PCOS sometimes starting from the menstruation. So to avoid that, yes, the first period they've got, thereafter they are PCOS because their weight is on a higher side. They're obese, overweight. So that has to be avoided. And my sincere request would be to learn Malasan and Surya Namaskar. They are very helpful. Yoga is very helpful for mental health and reproductive health system to get your periods normalized, right?
Okay.
तो आपको उसको incur करना ही करना है. We must learn it and practice it. Rest of the other exercise could be cycling, could be your skipping rope, could be badminton, which is fine. But yoga is essential. Once you do that, then your periods generally tend to be very regular. So
Okay.
all these 4 domains of nutrition, iron folic acid supplementation, personal hygiene, exercise, and vaccination. These are
Okay.
important things.
Right, ma'am. How wonderfully you've put everything together here for them. So, on that note, I really appreciate your presence with us today, and I'm hoping that the enlightening information shared will be valuable to many growing young girls, and I intend to see great leaders in them who are healthy, both mentally and physically,
Yeah.
eventually. Yes.
Thank
Thank
you
you
so
so
much. It's such an important topic that you have done and prepared for. I wish you all the best. Thank you.
Thank you so much, ma'am. It's really been a pleasure. And for more such informative videos, please do subscribe to our channel and press the bell icon for regular updates. Thank you once again.
Thank you.